Okay. Thank you for your patience tonight, Dr. Mike and Ziegler of Monarch Family Chiropractic. And tonight is a core chiropractic topic that we're talking about. It's themed or labeled vital needs. And when we're talking about vital needs, it's really the needs or what is necessary that if we take it away, what happens? If it is vital to life, if we take it away, what do you think happens? We die, right?
Yeah.
So what I would like to do, and we have a group of people in the office tonight, so it makes it more fun to engage in this way. But I just like to start with, what is, and if you're at home, you can add it in the chat, but what is vital to life, right? If we take it away, we will literally end life. So what is something that is vital to life?
Well, your organs.
Okay, so having a healthy, intact body, let's say we have that. Then outside of that, in terms of what we need from our environment, what is vital to life? Water, yes, okay. So how long can we live without water?
Well, the Westerns that I watch, usually about 3 days. That's what they say.
That is correct. You can live without water. Of course, there are other factors that you can take into account there, but you can live without water for 3 days. Okay. So is there something that is also vital, but less vital, where you can live longer without it? Food. Yes. Okay. So we're going to start there. Food, in terms of my writing. Whoa. So food is vital to life, right? We need to eat in order to continue living. How long can we live without food?
I'm going to say 14 days.
14 days?
Yeah.
Okay. Anybody else want to contribute? I think Gandhi kind of went crazy and he went 30, 40 days. So I mean, a couple weeks, I mean, depending on, again, factors of your own health history and weight and all and activity level. But typically we say, about 3 weeks is how long you could live without food. Okay. And then the next one was water. And we said you can live 3 days. What is more vital than water? Air. Okay. So how long can we live without air?
However long you could hold your breath.
Yeah, right. But even if we hold our breath, our body's going to revolt and we are going to pass out.
Yeah.
And we'll still continue breathing. But if we're underwater, right, or we actually have complete obstruction. So typically it's minutes. And at about 5 minute mark is where if the brain hasn't received 5 minutes, it's been 5 minutes, they say, okay, that's brain dead. So we'll say minutes here. Now let's just talk about this here, because some people are really tied to their food and nutrition, which I will never argue with that. This is important, but there is a hierarchy. If we come across somebody passed out in the middle of a trail, in the middle of nature, are we going to say, hey, let's give you some water? Or are we going to give them food? What is going to revitalize them and bring them towards life, to restore life more quickly? We're going to say, oh, did you eat this morning? Let's have a granola bar. Oh, let's give you some water. What is going to restore life faster? That food or that water?
I'd say water.
Yes. So we can agree that there's a hierarchy in terms of the length of time it takes for us to move towards death without this, and the length of time it takes to restore life. Let's say we've got a catastrophic scene happening across the street, and the EMTs come on the scene, and there's bodies laying everywhere. Okay, what are they assessing in terms of life for those individuals? Right, so they're going to look at, in case they want to check, is there loss of blood, right? So if there's any loss of blood or obstruction that's impacting this, They're again not gonna start here with, did you have breakfast this morning? So there's something in the hierarchy that's more vital than these. Does anyone have any guesses?
Oh.
It's
What
a
it-
long shot social interaction.
Social interaction. I really appreciate that. I appreciate that. Social interaction, we are finding, is one of the worst stressors that we could ever experience in terms of what will shift us into a diseased state. So I will not dispute that that is vitally important. But in terms of life or death, that one is going to slowly kill us over time, probably longer than weeks here. It's going to certainly impact our quality of life. We can also put in this sleep. I mean, there are, torture, ways of torture where we do sleep deprivation over, long period of time. And we'll say isolation, but we don't put that at the top as far as the vital needs. Any other guesses? And I appreciate when you contribute here. Any other guesses?
Nerve flow.
Nerve flow. We call it electrical impulse. Let's go with this for a second. If we cut the spinal cord right here, what happens? Is that life ending? Or can you survive?
I would say life ending.
Yes. We cut the spinal cord right at the brainstem. That is instantaneous. Life no longer exists, right? So we call this instantaneous in terms of how long we can survive without proper electrical impulse between the brain and the body. Now, if we cut the spinal cord here, will we survive that?
I think so.
Yeah, I mean, we can think of Christopher Reeves, who is, in my time, the original Superman, right? He had a horse accident, severed his spinal cord, left him paralyzed from here down. But if we have total severed of that spinal cord, it is instantaneous in terms of life.
Yeah.
So we start with this vital needs because a lot of people understand the importance of food. And I will not dispute that. And yet when you look at what is going to enhance and restore life in terms of what is necessary for life, these are all more important than your food. If you are walking around and you have distorted posture and you've got poor movement patterns, then you are not getting proper flow between the brain and the body. If this is a disconnect, or if there's anything going on here that's disconnecting you from the end organ, then if your lungs don't have proper function between the brain and the body, then they can't work like they're meant to work, even if you're getting proper oxygen.
Yeah.
And how often or how important do most people believe this to be?
How important, what?
Oh, I guess what does the average person, where do they put this in terms of the level of importance for the average person?
Probably a non-factor.
Yes.
Yeah.
I mean, it's probably like this triangle is tipped upside down if this even exists in their realm of thought. Now, I always like to go to, a child when they are born and when their brain is moving through development, what is most important in terms of that brain processing its world and moving through a healthy developmental stages. If you got distorted posture right away, if a kiddo has torticollis, and they're here, their head's tilted, all the information that their brain is receiving in terms of how it's processing their world, how it moves to development, how it grows, is totally skewed because this is what they believe is information received from their environment. So it totally skews their brain from the start in terms of how it experiences and processes. So we work up here And if you're doing these things, that is awesome and that is great. But if you're not getting checked, and if you don't have proper nerve flow between the brain and the body, all of these are not working at their best. So if you're spending a lot of money on nutrition, but if you don't have healthy nerve flow between the brain and the gut, then how well is the body able to assimilate that nutrition and use it in a way that can help support life and function, right?
Right.
And so I first wanted to start with really understanding what is essential to life. Now I want to talk about, with this lens, what's the fastest way to recovery? So I first want to just ask, let's say we have an injury. We'll start with an ankle sprain. What are we taught to do to help with recovery of that injury? What is it? Ice. Okay. So let's talk about ice. Where do you think, if we know this to be true, with an injury, and we're thinking, okay, with an injury, we want to make sure these components are taken care of, right? What does ice do? Say it again. Lowers. Okay, so ice lowers, and in some cases stops inflammation. Where does inflammation come from? What's doing all that stuff?
Gee, I don't know. But the blood flow
Yeah,
to,
right.
it slows down the blood flow.
Yes, it slows down the blood flow. And what's sending that blood flow? The brain.
Oh,
There is an intelligence happening within the body when you have an injury that creates inflammation. And we are taught to ice when there is an injury. And that's where I want to share this, because this comes up on your quizzes a lot. If I have an acute injury or a soft tissue injury, should I ice? And ice is totally ingrained in our treatment model of care. It is like something that we just go to.
ice and heat.
Ice and heat. And I mean, this is something that stated back pre-19, let's see, where's my dates here? 1978, I think, is when the Rice method really came into play. But ice has been around, before that. But around 1978, Dr. Merkin came up with the Rice method, right? Rice, rest, ice, compress, and elevate. You guys heard that before? And that really was utilized for a very long time. In 1998, they added a P to it to say protect. We want you to not just rest, ice, compress, and elevate. We want you to protect it. Well, come 2012, they said, well, actually, we want you to do something different, protect. Then we want you to load, ice, compress, and elevate. And then come 20, I don't know, sorry, 20, I think 17, 2019, no, 2014, sorry. So 1978 was when the Rice method came around to rest, ice, compress, and elevate. Come 2014, the doc who came up with that method that is so entrenched in things that we do in terms of acute soft tissue injuries, he said he retracted that method. He said, we are doing a disservice every time you ice a soft tissue injury. Because what happens, and I'm going to read straight from my article. It says, there is necessary benefits to inflammation. That would make sense because there's an intelligent process that's happening when inflammation occurs. So when we injure ourselves, our body and our brain specifically send signals out to our inflammatory cells, which release hormones, and these cells start to initiate healing by killing off damaged tissue. When ice is applied, it feels better. Why? Because it's taking away the inflammation, and inflammation is hot, inflammation is painful, and inflammation is swelling, that stuff doesn't feel good. But that's a part of an intelligent response by a brain and body to start healing the area. So when you ice, you're actually preventing the body from releasing important vital cells in order for the healing process to occur. And you're actually lengthening the healing time.
Really?
So in terms of ice and vital needs here, when we do ice for an acute injury, we're basically saying, we don't care about what you want. And we certainly don't want oxygen to the tissue because ice constricts everything, slows down the flow. And I mean, that means that we're not getting good circulation through the rest of the body. So in terms of vital needs, should we be icing a soft tissue injury?
I guess not.
No. And I mean, this is where Doc and I say, if you are swelling up, you know, and your body needs help managing that inflammation and swelling, then we like to use ice and heat in combination because ice constricts and heat dilates. So it helps bring circulation and movement through the tissues. But that's only, you know, that's specific scenarios. Okay. Now, what they're also finding in soft tissue injuries, and specifically, one thing they do after they go into knee surgery, they used to rest, and you know,
Yeah.
you're like, I'm familiar with this. We used to rest and protect the joint. They're finding that when we don't move the tissues in a healthy way, that slows healing. So now, what is shared is that we need to take that joint through a healthy range of motion and movement. Movement is going to stimulate the healing of the body. So movement is vital for healing injuries. And if you don't get that right away, it can hinder the healing process and lengthen healing time. So when we're talking about rest, ice, compress, and elevate, we're literally taking a joint and doing the exact opposite of what it needs. So I want you to think about every time you're getting adjusted, that is taking stress off of your nervous system. Every time we're correcting subluxation, subluxation is either abnormal movement in the spine or no movement in the spine. So segmentally, we're taking stress off of your brain and nervous system, allowing for the body to do its job. So if you're not getting adjusted and you're injured, then you're leaving a big component out in terms of how your body heals. And if you're actually putting up, you know, hurdles for your body to heal because you're icing, or because you're giving yourself an NSAID, a non-steroidal anti-inflammatory, which is like an ibuprofen or an Advil, which is chemically going in and taking away the inflammation, you're lengthening the time frame. You're creating an obstruction from this guy to do its job. Peter.
Could I ask you a real world question?
Yes.
I stubbed my toe terribly about 6 weeks ago, and I iced it for about a week, and then I let it heal, and it still gives me some pain. I was thinking about icing it tonight, but just let it go and let it heal on its own.
So what's going to be important, so the question was, I stubbed my toe a month ago and I iced it like crazy for the first week and still feeling it, and we were going to go home and ice it tonight because what does ice do? It numbs,
Yeah,
numbs it and feels better. But one thing that needs to happen is we need to support the body to get rid of the damaged tissue. We need to support the body going through its inflammatory process, and we do that through movement and stimulation of that tissue.
thank you.
So, I mean, what I would be doing with that toe is taking it through ranges of motion and movement, even if you have to passively do it. So this is your toe, you know, maybe you're doing passive movement and deflection and extension. Maybe you're doing, you know, getting some rotation through it. Maybe you're trying to take that joint through its lateral flexion. And then maybe you can start doing that on your own. But it takes a lot of work. And it takes some time. And then once you, again, damaged tissue can't go back to doing the exact same thing it did prior to the injury. You need to start training that tissue to handle that. And the reason we have damaged tissue in the first place is that we utilized our body in a way that it could not handle that level of stress. So we need to train and really stress the body in incremental ways to handle that stress. What we're doing right now in terms of how we treat our body is we are really not allowing for healing to happen in a healthy way and making it less resilient to handle any stress moving forward. Say, oh, you sprained your ankle, let's not use it. Let's not do these exercise activities anymore. Oh, you shouldn't be playing this XYZ, because when you do that, you sprain your ankle. That's the exact opposite thing we need to do. We need to start training the body and moving the body in a healthy way, globally, and then specifically to increase the resiliency of that tissue so it can do those things.
Well, I guess that's the problem with the way our Western medical thinks, because if anything hurts,
Yeah.
they always say, well, take a pain pill or do this or do that, because we don't like pain.
Yeah. And pain is the only way we really assess for health. So where on here in terms of the vital needs is pain? This doesn't care about your pain.
Yeah.
And so again, we get lots of other symptoms that show up before we feel pain. In terms of this component, it's we get thirsty, we start to pee less, and then we start feeling hungry, and then maybe we start to look more shriveled. Our body's like trying to retain the water that we have. But that's not pain, right? So I mean, we've got to look at our body in terms of function and how we take care of our body and take care of our health. We need to start looking at it through our vital needs. And if we're trying to restore health, and by the time you're in a low back pain situation, or you're in a headache situation, or you're in these symptom-based situations, you've got a lot of work to do, because we've been, this hasn't even really been connected in its pattern in the way that, it's just trying to adapt and survive. And you may be here, but life expression and 100% of what we can experience is here, and it takes work to get here. Does that make sense? So that's where, if we see somebody who has, phase 1 degeneration, that is like just curve changes, that can take years to rehab and support healing and recovery. There is no process that does not require time. And so when you're talking about health and vitality, it is we're on a trajectory in life. We're not going towards an end point, right? It's not like we're just, we want to be at this pinnacle. No. Everything we do, all the choices we make are putting us towards and on this path, either of vitality and ease and life and, potential, wellness, health, or it's putting us towards dis-ease, death, sickness, dysfunction, right? Disorganization, chaos. Life over here is where most people hang out. They're really living an average experience and they don't know any different, because there's so much brain fog. They're so disconnected, and they're just trying to get through their day. And they're consuming chemicals and foods that are just continuing to pull them down. And this has never really been connected well, right? And they're, instead of drinking water and good, hydrating themselves, they're drinking pop and, juice and tons of stuff. And so our goal over time is for you to be in this world, but it takes a lot of work. It takes a lot of commitment. Peter, what's that quote that you love?
Oh God, I wish you,
Wish it was on the wall.
Yeah.
It takes a lot of work to be healthy, but it's a full-time job to be sick.
Yes.
Oh, yes, yeah.
Yep. And so, I mean, my challenge to you is when you're thinking about your choices day to day, you have your vital needs in mind. And you know that movement stimulates good, healthy brain activity. But if it's a poor, distorted movement, that's feeding the brain not great information. So that's why chiropractic helps with, again, that brain body. So I really appreciate that you're here with us tonight. This is a fun week in our practice. We are celebrating you. We are celebrating our community, the people who choose to show up on a regular basis and support your health and your vitality and the trajectory you are on. You are committed, you are dedicated in a way that the average person, you know, who maybe doesn't know that there's a different way or just hasn't, you know, is choosing not to, choosing different things. And so we really value and appreciate your choice to show up tonight, to show up with your adjustments on a weekly basis. Some people are in their first couple months of care. Some people are years and decades into their care. And we value that. Because, you know, unfortunately, that's not common or that's not normal, nor is it common. So it's Appreciation Week. Thank you for everybody who shared what they know, who referred the people that they love. And my hope is that you continue to share your experience with the people that you love and care for. And, you know, some people have never heard this message. So we ask that you share it with them.
I love the health pyramid.
Yeah, the health pyramid, I love that. And it's never too late to get checked. You know, this is Appreciation Week. We are offering a really wonderful thing for people to come in and get checked and then some. But, you know, we're happy to check anybody. We'd love to do it. So Dr. Mayakin of Monarch Family Chiropractic, thanks for being with us tonight. And we'll see you next time.
Wow. Thank you. This was good. I enjoyed this one.